Good morning, my name is Lidia Sierpińska. I am representing Poland at the 4th edition of the World Congress on Virology and Infectious Diseases. In my presentation, I will present the results of an analysis of the expectations of patients with hepatitis C towards family doctors. I would like to point out that chronic hepatitis C develops in approximately 70 to 80% of infected patients, who require constant care from a family doctor. Meeting patients' expectations in primary health care contributes to improving the quality of care and treatment. An important aspect in the course of hepatitis C is to ensure early diagnosis, pharmacological treatment and dietary management for infected individuals. Patients who learn that they are infected with HCV often experience many concerns related to treatment, prognosis, and their future functioning in family and social life. Patients with hepatitis C should remain under constant medical supervision in outpatient settings. Family doctors should provide them with professional medical care and a sense of security. Therefore, it was considered important to learn the opinions of patients with chronic hepatitis C regarding their expectations of their family doctor in terms of explaining the nature of the disease, obtaining information about tests and treatment, and providing emotional support. The aim of the study was to analyze the expectations of patients with chronic hepatitis C towards family doctors and to determine the relationship between selected variables. Research material: 220 patients who were infected with HCV in Poland at various times were examined. The average age of the patients was 54 years and 0.7 months, plus or minus approximately 12.5 years. The youngest respondent was 18 years old and the oldest was 87. There were more women in the study, 52.3%, than men, 47.7%. More patients lived in cities, 66.8%, while about 33% of the respondents lived in rural areas. The educational background of the patients was as follows: primary education 9.5%, basic vocational education 38.2%, secondary education 37.3% and higher education 15%. The study was conducted between 2014 and 2018. A diagnostic survey was used as the research method. The technique was a questionnaire. Two tools were used in the study. The first was a proprietary questionnaire designed for the purposes of this study, which included questions on socio-demographic data, self-assessment of health, feelings of disability, and dietary recommendations given by the doctor after the diagnosis of hepatitis C. The second tool was a standardized test, patient request form, abbreviated as PRF. The questions in this test concerned the doctor's involvement, explanation of the disease, its nature, course, causes and pathological symptoms. They also concerned expectations of the family doctor in terms of emotional support, for example, advice on nervousness, talking about feelings related to the disease, sources of emotional problems and receiving support in difficult moments. There were also questions about expectations of the doctor in terms of receiving information about tests and treatment. Among other things, these concerned the results of diagnostic tests, their discussion, confirmation of the diagnosis, referral to a specialist, advice on medications, the risk of adverse effects of the disease, instructions for taking medications, and explanations regarding the treatment used. Here are the results. Most respondents expected their family doctor to explain their illness. The average score on the PRF scale was 9.67, and information about tests and treatment, where the average score on the PRF scale was 9.65. The study found that respondents had low expectations of emotional support from their doctor, with an average PRF score of 6.92. These values ranged from 1 to 0 points. It was also found that as the age of the respondents increased, so did their expectations regarding information about tests and treatment, and emotional support due to hepatitis C. These results were statistically significant. Women had higher expectations of their family doctor in terms of explaining the disease, while men had higher expectations of emotional support. They were more likely to expect information about testing and treatment for hepatitis C. These results were statistically significant. Urban residents were more likely than rural residents to expect explanations of the disease, emotional support, and information about testing and treatment. These results were also statistically significant. Married men and women had higher expectations of their family doctor in terms of explaining the disease and providing information about the disease and treatment. It was also proven that respondents who were divorced expected emotional support to a greater extent. It was found that the higher the level of education of the respondents, the higher their expectations of their family doctor in terms of explaining the disease. Most of the respondents were not professionally active, about 61% were not working. This group of respondents expected emotional support and information about tests and treatment to a significantly greater extent. It was also proven that patients who were prescribed a diet by their doctor after being diagnosed with hepatitis C expected emotional support to a greater extent than patients who did not have dietary recommendations. These results were not statistically significant. Here are the conclusions. According to the PRF scale, patients with hepatitis C expected their family doctor to explain the disease and provide information about tests and treatment to the greatest extent, while the smallest group of respondents expected emotional support. No significant correlations were found between the expectations of patients with hepatitis C towards their GP depending on age, gender, place of residence, marital status, self-assessment of health status, and recommended diet. Respondents with higher education expected their family doctor to explain the disease to a significantly greater extent than respondents with other levels of education. Respondents who were not professionally active expected emotional support and information about tests and treatment to a significantly greater extent than those who were professionally active. Patients who felt disabled due to hepatitis C expected emotional support and information about tests and treatment from their family doctor to a significantly greater extent than those who considered themselves able-bodied.
I uzyskania informacji dotyczących badań i leczenia. Wyniki badań potwierdzają.
The results of the study confirm the need to improve the quality of medical services provided to patients with hepatitis C by family doctors in terms of explaining the nature of the disease, providing information on tests and further treatment, as well as emotional support during the visit.
I dalszego leczenia, a także wsparcia emocjonalnego w trakcie wizyty.
Thank you for your attention. I hope that the presented study results will inspire researchers to conduct further, in-depth research on the expectations of patients with hepatitis C towards family doctors.
Z wirusowym zapaleniem wątroby typu C wobec lekarzy rodzinnych. Dziękuję.
Thank you.